A Wheaton Franciscan Healthcare All Saints sponsored Aim for Health Award is given to an employer in our business community that has made significant efforts in the past year to create or improve a work culture for a health-minded workforce. The criterion used in designating this award includes the following: participation in health risk assessments, participation in the Well City Racine Initiative, on-site or dedicated health coaching, health education, healthy lifestyle programs that incorporate smoke-free environments, exercise, nutrition, and stress management. The goal for Wheaton Franciscan Healthcare All Saints is to partner with the business community in offering some of the services listed and ultimately having a positive effect on the financial health of the employer and, most importantly, the overall health of their workforce. This year's Aim for Health Award goes to Racine Unified School District.
I believe it's important for the district to implement wellness initiatives because it brings about an increased awareness to our employees so that they can make informed decisions about their health and well-being, which affects not only themselves but their family and our students.
Well, I think the most important benefit is I think there's a direct connection between healthy staff and education, student learning. I think you're aware that we have this goal, the North Star, of getting all students career and college ready. And if we have a healthy staff, we have a better chance of promoting student learning. Our staff will be more energetic. They'll be able to devote more enthusiasm, more attention to student learning. So employee health is essential to our major mission. Then there's some secondary benefits. A healthy staff, I think, is a happier staff. The morale will be improved. Just the quality of life for our employees and for our employees' families. And I think that has an impact on the entire Racine community. So I think it's a benefit to the Racine community to have a healthier staff at Racine Unified School District.
The Wellness Initiative helped me by the day that I went. I thought my numbers were all good as far as health. And I was shocked to learn that they were at an unhealthy level, and I was referred to my doctor. And I am so glad that I went because that made me be realistic about my health, and I needed to be in control. And so it was really good that I went.
The district's formed its wellness committee really to start the whole wellness initiative. We've had several events or programs that have gone through. They've been well received. We had a health risk assessment. We've had a health challenge where people kept track of how much they walked and exercised. What it has done is the committee, through the committee's work, has made our employee or our workforce much more cognizant of how important it is to be healthy. And as we move forward and as the committee does additional work, that's going to be the emphasis. It really is for the individual's benefit to be healthy, which in turn helps the school district and helps the finance, which I'm always interested in.
I think one of the most important things that we've done this year related to wellness was probably the health risk assessment and the biometrics. I think that served two purposes. First, it gave the employee a very good idea of what their overall health risks were and some positive suggestions about how they could attain or maintain health. I think it also helped the committee, again, to know how to frame the program because we had some good aggregate data about what our employees' needs were.
Our employees have reported many different positive effects of our wellness program. Some of those include reduced injuries, improved healthy choices, reduced absenteeism, and increased productivity.
First of all, we care about our staff, our employees. We want them to be healthy. We want them to be as productive as possible. But this is a school district, it's a school system, and our staff influence students. And by their behaviors, they model a healthy behavior for our students. So we think when we have a healthy staff, a staff that is engaged in the promotion of healthy practices, that will influence our students, and we'll have healthier students as well.
Well, the most important reason is to maintain a healthy workforce. Our employees are very important to the district. In addition, there is a financial implication. If you have employees that aren't well, that can cause problems like substitutes, as well as long-term costs in terms of health care. The district has looked at research that shows that if you work on wellness, it does reduce your long-term health care costs, whether it's in premiums or other things such as missed time.
I think the most important issues that the employer should focus on for their employees is what the employee has as a concern. We can guess and we can try to decide on our own what that is, but unless we really survey the employees, find out what they want to have, we'll probably miss the mark. So I think we did do that this year with the employee survey and using some other results, and I think that's why we had a good participation.
The Wellness Initiative has helped me with my lifestyle changes going forward insofar as I'm more focused and more cognizant of what I'm eating and the effect that it's having on my body.